Hi, everyone. Thank you for joining us for what promises to be a very interesting and insightful conversation around suicide prevention. We're doing this from the Health Collective, in time for World Suicide Prevention Day. My name is Amrita Tripathi, and I'm really pleased to say we are joined today by Dr. Soumitra Pathare, who's a psychiatrist and director of the Center for Mental Health, Law and Policy. We are also joined by Tanmoy Goswami, who's a mental health advocate and sanity correspondent at The Correspondent, which just turned 1 year old. So congrats, Tanmoy, and thank you both for taking out the time.
Thank you.
Thanks, Amrita.
So I want to start by asking you both. This is an area you're both very passionate about. I know we have the world's attention for at least one day, the day that is Suicide Prevention Day. But there's also there's so many strands we can pick up on, which goes to show the lack of understanding on how grave the issue is in India. For example, that it is the leading cause of death for young Indians. And of course, the recent spectacle, which we're kind of all living through when it comes to the high-profile case the media is tracking. A lot of people have said they find it very triggering. So my opening question to both of you is, and maybe I'll start with you, Tanmoy, why is it even important to talk about suicide prevention, given how loaded a term it seems and how intense it seems as a subject for many people? Why do you think it's important to even have this conversation?
I think, if you enter a crowded room, 500 people, and ask for a show of hands as to how many of them have been affected by a suicide or a suicide attempt in their personal circles, maybe 80–90% will say that they have at least some experience. So clearly, suicide prevention is not something that we can just close our eyes and wish away. It is everybody's business, and I think this is an open secret. Our society doesn't like talking about it, but it is all around us, and we can't just wish it away. And we can't think that this will never happen to us, that this is somebody else's problem. To my mind, that's the most basic fundamental reason why we need to talk about it, and not just one day of the year, not just being tokenistic about it, but really understand that each one of us has a role to play, and each one of us can actually do a lot to save lives around us. So I would say that's the simplest, most fundamental reason.
Thank you. Dr. Pathare, your opening comments on why it's important to even have this conversation.
Well, for the simple reason that suicides are preventable. We can actually stop people dying unnecessarily, and especially stop our young people dying unnecessarily. Everyone talks about India's demographic dividend. Well, as of now, India's demographic dividend is actually killing itself. There is going to be no demographic dividend. And so working on, trying to prevent these suicides is extremely important. We have the highest rate of young people dying by suicide. Among young people, as you said, suicide is the #1 cause of death, especially among young women, and #2 in young men. So if we are going to prevent deaths, especially among young people, we have to talk suicide prevention. And suicides can be prevented. We need to get out of this fatalism around suicides, that anyone who wants to kill themselves will ultimately kill themselves. It's completely untrue. It's a myth which has never been proven. In fact, most people who survive a suicide attempt, if you talk to them later on, are actually very glad that they survived, are glad that somebody saved them, are glad that they got a second chance at life. So, I don't think we should take a very fatalistic attitude to suicide prevention. And, we could save a lot of lives.
And, part of the attempt to sort of demystify suicide, make it easier for people to have these conversations. We're featuring an interview with Dr. Nandini Murli, who's a suicide survivor. She talks very movingly about how, her husband died by suicide, and how families and survivors, then feel that added burden of stigma and shame, because societally we can't have this conversation openly, right? So I do want to ask you both, how important is it when we try to make this a conversationally accessible issue? And I think I know the answer to this question, but how important, Tanmoy, is it to be equipped with the facts, know that, for example, it's a multifactorial issue, that there is nuance to this. And of course, we want to tell our viewers that helplines are available even in India.
Yeah, absolutely. I think as Dr. Pathare said, there is this fatalism in Indian society that nothing can be done to prevent suicides. And then there is this other myth, which is very damaging, that all suicides are the result of mental illness. Just this morning, somebody, I think probably that person is a psychiatrist himself, said that suicides are the result of depression, very definitively the result of depression, and that we need to identify and treat depression if we have to stop suicide. And I think that's really a very damaging myth, because that just stops us from addressing deep-rooted social problems, unemployment, debt, violence, casteism, sexism, all kinds of social justice problems have a link with suicide, and indeed with mental illness also, but they're separate. They're two separate things. So I think to that extent, if we have to feel empowered to stop suicides, we have to start talking about these social inequities and all the structural injustice that is built into society. And secondly, I think because a lot of young people, as Dr. Pathare pointed out, are affected by this, they're so connected. We know that they live on the internet. They are digitally literate. They're very savvy. We have a great opportunity to really start a dialogue, promote literacy, because this is not the demographic that is that will close its eyes to outreach efforts. It's easy to get their attention if you do it in a compelling manner. So I think those are some of the things that we need to do to drive home the nuances, and everything that we can that we need to address, rather than just fixating on this monolithic idea of suicide being the outcome of mental illness.
Yeah, and Dr. Pathare, just adding a layer to that, while we're having the conversations or trying to have the conversations, there's a lot of sensitization and education that needs to be done. You're also, with Tanmoy, I think we've been talking about media literacy and why that needs to be a focus. Can you take us through a little bit of that? And people who might say, why should it even matter, whether the media is trained in coverage, what would you say to them?
We have very few evidence-based interventions for suicide prevention. It's unfortunate, but that also shows how much we've neglected suicide prevention as a society across the world, not just in India. So among the few evidence-based interventions that we have are interventions which are based around media reporting, because there is sufficient evidence now that how media reports suicides can have an influence on the number of suicides that happen. So given that we have that kind of evidence, improving media reporting so that it helps the cause of suicide prevention is something that we need to actively do. And unfortunately, we haven't done that very well. Other countries have taken proactive steps to do that. International organizations have got guidelines, and most recently, even the Press Council of India in India issued guidelines for how to report suicides as well as mental health. Unfortunately, we've not seen that happen on the ground. Print media, television media, social media still deals with suicide in a way which is not very helpful for the cause of prevention.
So if I were to ask you both, I mean, you're working, on different projects in this area. Even as, Tanmoy, coming from your base as a journalist and, knowing what editors need to know. I know you've done workshops, including together. Do you want to take us through a few key areas that have come up? For example, what are some common misconceptions, even among the media, within the media, when it comes to suicide and suicide prevention?
Yeah, thank you for asking the question. I think one of the most challenging notions to get rid of is this idea that language is harmless. How does it matter if we say commit suicide? That this is just a bunch of woke people trying to censor us, regulate the way we write and report. So just getting people's awareness levels up on the issue of sensitive language use has been a phenomenal challenge. Why should we not use triggering graphics? Why is it very dangerous to give away the method of suicide in detail? What are the implications of not respecting the privacy of the survivors? These are some of because suicide has largely been reported by the crime reporters in this country, because suicide was a crime for a long time. and still the police, although we have now legal provisions to decriminalize suicide, but still we keep hearing of cases where survivors of suicide are harassed by the police. And so I feel, given that there is that aura of criminality associated with suicide, um, the media community almost feels like they have no obligation to be humane, because after all they're reporting on a crime. So that has been that mindset change. But I must also at the same breath acknowledge that through all these workshops that Dr. Pathare's team and we've been doing together, I've personally been extremely impressed. I think there is a lot of reason to be optimistic. We've all trained over 100 people already on the basics, and these are interactive workshops, and I'm sure we'll announce more in the future. And I'd strongly recommend anybody who's watching from the media community to participate in these workshops. They're interactive. There are exercises built in. And then the other thing that we are very excited about, and Dr. Pathare might want to add, is as part of the Indian Mental Health Observatory, which is which is a project that is being steered again by Dr. Pathare's team. We are starting something very unique, very new, which will hopefully give data-driven solutions to the media. A data-driven sort of shed a lot of light on how the media reports suicide, and hopefully help them do this better. I think it's going to be, the launch is imminent, and Dr. Pathare might want to talk more about it. And then the third thing I think is just, to remember that this is a relentless process. This is not something that, like he said earlier, there is no single magic bullet. And we have to keep at it, and it's very easy to become cynical because we all know what's happening on TV these days. It's easy to become cynical and lose heart, but there is a lot of positive development that we need to take heart from. I think it's important to remind ourselves we have a Mental Health Care Act now. A lot of ordinary people with no affiliations with the mental health movement or the suicide prevention movement are becoming extremely vigilant and calling out the media constantly. And a lot of big media houses are taking down stories, amending headlines. So all of that is also happening. So yeah, I think from a journalist perspective, those are some of my impressions of the current sort of zeitgeist.
Pathare, could you also weigh in on this?
Yeah, I wanted to pick up on what Tanmoy said, that suicide prevention is a 365-day-a-year business. It's not a one-day-a-year thing. So while I know that it's important to talk about suicide on the World Suicide Prevention Day, it's equally important, or even more important, to talk about suicide prevention in the remaining 364 days of the year. Which is not what happens very often. These days are celebrated in a tokenistic manner. Everyone makes these grand announcements or suggestions, and then everyone goes back to doing what they did before. So I think we need to also kind of get it across to people that this is a all year round business. You're not going to do suicide prevention by doing it on one day of the year. The second thing is that I agree with Tanmay that, you can't get despondent about it. I mean, there are no easy wins. Any one of us who's tried to work in the area of behavior change knows very well that takes time. It happens gradually. It happens slowly. As Tanmay said, there are lots of positives. I've seen more positives in the last 365 days than maybe I've seen in the last 10 years. So let's not just say, of course, there's a lot of distance to cover, but let's not forget how much of the distance we already have covered, starting from where we are at. So I think it's important to not kind of forget about it. And I think one of the most heartening things for me has been that how suicide survivors and people who have lost families who have lost people to suicide are now coming out and talking publicly about it. And I think that probably is one of the most important factors which will destigmatize the talk around suicide. Even with other health conditions, like say with AIDS and HIV, what we saw is that the movement really took off once people who were living with HIV/AIDS started talking about it, when their families started talking about it, when they led the whole process. I think as a professional, I know that I can only do so much. I think people who have experience of having lost someone to suicide or have themselves attempted suicide are probably the best people to make a strong case for suicide prevention. So I'm quite happy to see that happening. And I think that in the long run is probably going to pay a lot more dividends than any amount of workshops and seminars and webinars that professionals hold for each other.
So at one level, yeah, go on.
Yes, something that I should have added earlier is that just as we say that mental health is a spectrum, like nobody is perfectly mentally healthy every day of the year, it's also important to understand that the experience of living with suicidal ideation is also a spectrum. Like, it's something that builds up over time. Of course, there are impulsive suicides also. But why I say this is because, this connects up with the fact that this is a 365-day exercise, because you never know when you might end up impacting the life of somebody, or changing the mind of somebody who's on that spectrum, and you prevent that person from sliding further down, and you stop them when they're at an early stage. So when we talk about suicide prevention, often we think about, we imagine it in terms of pulling somebody back from the brink, that need not necessarily be the case always. It's not like we need to intervene only when somebody is about to do this. So it's important to understand that it's a normal human experience. Morbidity, morbid thoughts, these are normal human emotions. And, therefore, let's have our antenna up, and let's not wait for despondency to set in to the extent that a person has to call a helpline or see a psychiatrist or see a therapist. Each one of us, if in our own families and our social circles, we are listening for these cues, we can do a lot just by way of peer support.
I was going to say, because I think that having, people share. So, for example, in some of the interviews I've done, or this, this book we worked on called Young Mental Health, we have someone called Manisha Chacha who's joining a tweet chat as well, where she, as a journalist, shares what has, helped. She sort of crafts a narrative talking about what helped her, but she opens with this, pretty rough phase she was going through, where most people kind of minimized or negated her experiencing, oh my God, it was just an exam, or why would you feel this way? Whereas one friend kind of talked her home, right? She was at the metro station feeling desperate, and one friend was able to just stay on the phone with her. And we'll be getting more from her on how we can be there for each other. But I do want to put this to both of you, because I think, Dr. Pathare, in one of our interviews, you spoke about having a reverse Maslow's hierarchy for where at the base level, we can all talk about what we can do as just members of a society, right? Individually in our families, like Tanmoy said, what are some of the things you would want people to be on the lookout for without making everyone super jittery and paranoid in this era we live in? And what are some tips for people who care?
Well, one of the things that we do know, for example, with people who have attempted suicide or people who have died by suicide, is that they would have talked about suicide or mentioned suicide or talked about death in the preceding week before the attempt. They would have talked about it either to family, friends, or sometimes even to their doctors. And I think one of the most important things, and that's probably the most crucial point where you could intervene, where all of us can intervene. People have this worry, oh my God, I shouldn't say something wrong. And then the person does something and I'll get blamed for it. My answer to you is very simple, that you can't say anything wrong. If you say something from the bottom of your heart, if you show care, if you show that you are interested, and very often you are not expected to do anything other than to listen. And that's probably the hardest thing for all of us. We have never learned to listen. We have learned to respond. We have learned to do things. We have not been taught or learned to just sit back and listen and take in what somebody might be saying. So I think for the average man on the street or average woman on the street, the answer is very simple. If you hear somebody talking to you, a friend, a relative, a colleague, mentioning something that sounds like they are thinking of dying, or they're thinking of death, or they're thinking of suicide, then just ask. Your asking is not going to make anybody feel suicidal. People have this odd idea, oh my God, if I ask this person, are you feeling suicidal? Then they might get ideas about suicide. That's completely wrong. It's a myth which has been disproved so often. It's not like someone's going to say, oh, thank you so much. I hadn't thought that I could kill myself. Thank you for letting me know. That's not how it happens. I think if you ask people about suicide, they are likely to feel that, you can make a connect. They will probably appreciate the fact that you can understand the distress they are going through. And if they're not feeling suicidal, they'll say, look, I'm fine. I'm not reached that stage, or that's not how bad things are. And they'll say that. But if they are, they will actually appreciate the fact that you ask them, and then gives them the opportunity to talk about it. That. And ultimately, what does a suicide helpline do? I mean, when you tell people, oh, call a suicide helpline, what does a suicide helpline do? A suicide helpline has a bunch of volunteers, not professionals very often, volunteers who are trained to just listen, not necessarily offer quick solutions. So they learn to listen. They learn to listen to somebody who is feeling suicidal. Now, that's something that all of us can do, even with minimal training and even without training. I mean, even in our normal lives, we know how we react to friends or family who are feeling distressed. You need to do the same when you think somebody might be very distressed and thinking of dying. That's really all that is required, which we should promote and encourage.
That's really helpful. Tanmoy, what would you say? And this is kind of how we'll probably conclude as well, maybe with a call to action for people.
Yeah, I mean, I couldn't agree more with everything Dr. Pathare said. As somebody who has whose life was saved by the simple act of somebody talking to them, um, and again, like, one person's experience is just one person's experience, but um, whenever somebody asks me what can I do to help a distressed friend or a colleague, this is exactly what I tell them. Just talk to them, ask them. And I think the other thing is, apart from listening, which is incredibly important, often it is the small things that really break a person's back when they're going through a bad period, when they're really low, when they have no energy, they have no motivation. You don't have to extend grand gestures all the time. You can do small things. You can, maybe pick up grocery for them. You can maybe drop their kids to school. You can, take the dog out for a walk. Because when one is in the depths of despair, whether that is because of a diagnosed mental illness or not, it is these things that become unbearable and sound and weigh very heavy on you. So often you don't need to run somebody else's life for them. You don't have to necessarily take them to the psychiatrist or whatever. Just volunteer to do whatever you can, the little things. And I think that is often the role of that is often underestimated. Just that sort of human connection and saying, I am here, and you can talk to me about anything. And very important for parents to, I mean, just a few days ago, I was reading Sandhya Menon's tweet about how she talked to her children about suicide. I think that's an incredibly. I mean, we keep talking about sex education in this country, and we've not gotten anywhere. But I think we need to start talking about how to talk about suicide with children also, since they're a very, very vulnerable demographic. And suicide in the family impacts them the most, and we probably hear the least from children. So I think, yeah, that's what I would suggest.
That's incredible. I'm putting up your handles as well. We're hoping that when I don't need to say this, you both are very responsive on social media. So when people tweet you questions, I know you'll answer them. But we'll also collect some of the questions for you. I just want to say, for last words, what is your one hope in the next 364 days before the next World Suicide Prevention Day? Dr. Pathare, if you had one hope for India for the next year, what would it be?
Let's talk. I mean, if we can get people talking, like what Tanmay said, you don't need to do a grand gesture. Sometimes just saying, let me get you a cup of tea and we'll sit down and talk, is all that is required. You don't need to solve people's problems. That's not what suicide prevention is about. You're not expected to have some grand gesture of solving the problem. Just sit down and talk, and maybe make the human connect. After all, what's going to stop somebody from attempting suicide or dying by suicide is the human connect. It's we who are going to save each other, not anybody else.
And Tanmoy?
Yeah, I'd say, if we become more aware and open to the possibility that exists beyond the healthcare system. So, for instance, how Dr. Lakshmi Vijay Kumar ended up preventing a lot of suicides in Chennai by incorporating a supplementary exam in the academics session so that children don't lose a year if they quote unquote fail an exam. Or how by preventing access to pesticides in India as well as in Sri Lanka, so many suicides have been prevented. These are creative, smart solutions, but they all started from the premise that suicide is not just a healthcare concern. So I wish, my wish for India for the next year would be that we start talking about all the multi-sectoral things that we can do, all the interdisciplinary interventions, and everything that Dr. Pathare said also.
Yeah, so I'm just going to do a +1 to both of you. Thank you both so much, as always, for making the time and for all of your efforts in this space. I think it's really important, as we've highlighted, and I hope those of you who've been watching, you found some insights. Do feel free to reach out to the panelists or just send us your comments if you have any. Thanks again for watching.
You too, Amrita. Thank you so much.